My name is Tom de Potter. I work as an electrophysiologist in the Cardiovascular Center in Aalst in Belgium, where I function as the Associate Director of the Cardiovascular Center. So CryoCure 2 is an open label study that was designed to study the feasibility of a novel ablation platform for treating atrial fibrillation, paroxysmal or persistent atrial fibrillation. CryoCure 2 was designed to recruit patients selected for an ablation procedure and monitored acute procedural efficacy as well as clinical outcomes at 1 year post-procedure. Ultimately, 79 patients were recruited into CryoCure 2. Being an open label study, there is no comparator arm. The key findings of CryoCure 2 were first and foremost that in terms of clinical efficacy, we were very happy to observe an 82% clinical efficacy at 1 year after a single procedure in terms of successful treatment of atrial fibrillation for the entire patient cohort. And for the specific subpopulation of patients with persistent atrial fibrillation, which was the majority of the study population, we saw an 85% clinical efficacy rate. Furthermore, we saw in terms of acute procedural efficacy that the procedure can be done in a very reasonable amount of time. The average procedure duration was under 2 hours for the study cohort, which is, I think, certainly impressive if you consider the first-in-man nature of the study design and if you consider the additional time that is typically needed for study purposes in such a trial. And perhaps even more importantly than the average procedure duration was the observation